week's news special report.
Hello, North Dakota. Good afternoon, and welcome to today's press briefing. Today, the North Dakota Department of Health confirmed 28 additional cases of the novel coronavirus disease, or COVID-19, out of 387 tests. This marks, for the second consecutive day, the highest number of positive cases in North Dakota since the pandemic began. 13 of today's 28 cases were under the age 40, and one was under age of 10. When we take a look at the numbers on this first slide, important one to look at is that 7.2%. Again, our trailing average since the beginning was always floating around 3% of the total tests being positive, with the 4 days in a row where we've had percent positive above 5%, including today, which is a near high of 7.2%, then that's dragging our trailing average up to 3.4%. It's still the second lowest in the nation, but we have, with these 4 consecutive days, we're starting to see the trends go up, and with the second largest day back to back, what we had we're concerned about perhaps is realizing, which is that we're still in the rising part of the curve. When we take a look at active cases, 221 in the state. One of the good pieces of news, on a day when we had 28 new cases, we had no deaths, and we had 21 recoveries. And so the net, if you look at the very next slide, that shows the below the line in the green is the recovereds, and at the top line is the actives. It only went up by 7 to the number that we're at now, to 221, because we had all those. We had 28 new cases, but we had 21 recoveries, so that's a positive thing. And grateful again that we had no deaths in the last 24 hours. When we take a look at cases by county, we wanted to get focused here on the fact, because some people are again saying, hey, we've got considered a hot spot in Cass County because we have the most number of cases at 87. In Cass County, there are also about 40 cumulative cases in Moorhead. Some of those have recovered on the Clay County side. But as our largest metro area, in that area, when we take a look at the percentage per capita, again, want to remind people that we are doing testing comprehensively across the state, and that Fargo now has dropped below the state average of their less than 5%, or the Cass County's less than 5% of those tests that are positive. And in fact, we have a number of counties here illustrated in the darker blue in the northwest that are substantially higher. So again, on a per capita basis, we've got a higher concentrations in the northwest. One of the things that we talked about when we talked about being able to move towards the North Dakota Smart Restart was that we had to increase our testing capacity. And as I shared yesterday on testing, we did have a backlog when our machines went down, but happy to report we did, the Abbott technician that we picked up in the state plane, they worked through the night along with the lab technicians to catch up, and there's no longer a backlog. But as you can see with the testing numbers today, only 387 tests. The state right now has enough tests, enough testing kits, and enough lab capacity to be testing at a substantially higher number. So again, would encourage all of our providers, the way we get ourselves back to work is with broader testing. I want to make sure that everybody understands that there was different testing criteria when people were short of supplies. Minnesota had tighter restrictions and South Dakota had tighter restrictions on testing than North Dakota. We want to make sure, again, that all the providers and anybody out there who's concerned about the symptoms they have or feel they may have exposure to someone who's positive, to contact your provider and advocate for yourself to get a test, because if you're feeling like you need a test, we want you to get tested. We do not want to see any more stories on social media where people are saying, hey, I tried to get tested and I couldn't. There'd be no reason for that because we do have enough testing capacity. So if you have wanted to get tested and couldn't, another option for you right now is call the North Dakota Health Hotline, and that, again, you can find that at the northdakotahealth.nd.gov, and we'll make sure that we can help advocate for you with your provider, that particularly if you're in a vulnerable population, either because you've got immune issues, or not issues, but if you've got an immune system that's been hampered, whether that's chemotherapy, whether that's through some disease, if you're elderly, or if you've got underlying health conditions, or even if you're normally young and healthy, but you've got the symptomatic things, we want you to get tested. And right now, again, we've talked about getting the testing numbers up. We have to get the testing numbers up to make sure that we're really capturing the full picture. That's what's going to allow us to open up. But right now, 387 people seeking a test is not enough in North Dakota. We know there's more people out there than that are not, perhaps not feeling well. So again, all testing is paid for. Should be no cost to you. So from the standpoint of if you're not feeling well, don't think about this from economics. Tests are free. So go out and get tested. As we we have available testing capacity right now, but we're also trying to ramp it up. We began doing that this week, and by the end of the week we're on track to double our testing capacity to over 1,100 tests per day. Yesterday, in addition to the other repair work that was going on at the state lab, we did validate a machine, a Cephia Gene Expert machine. It's got increased capacity, and it's also got a 45-minute runtime, which is faster than many of the other machines for high priority samples. And we have additional equipment being assembled. We have to validate that equipment. That's early next week. So we'll continue to add more equipment. We're also planning for the capability to add a third shift at the state lab as early as next week if necessary. Currently, our state lab is able to keep up with the testing, and they're operating now on 2 long shifts that run about 16 to 17 hours a day. So again, thank you to everybody at the state lab. And then also at the state lab, we are trying to drive, if we're going to get to 1,100 tests here shortly by the end of the week. The plan is to get to double that again in May to over 2,200 tests. In June, double it again to over 4,000. So we're going to keep doubling that capacity, and that's at the state lab. We know that our private partners that we work with, including Sanford Lab and Mayo, are also adding capacity. So again, we have the capacity to do more testing, but we need help from our providers, and we need help from you as individuals to go out and get tested if you think you need one. Next topic relates to CDC. CDC was in North Dakota this week. We welcomed a CDC Community Protection Team. They have 5 team members. They arrived Sunday, April 12th. They're in Grand Forks today, helping with the LM testing event. And this relates to the LM wind blade plant in Grand Forks, where we had a small outbreak there that we're working to quickly contain. But they arrived not because of the LM event. They arrived because North Dakota was chosen by the CDC because of our low incidence of COVID-19. They wanted to learn about the current success story that we were having, share best practices, and the lessons learned with other states. And their goal is to help continue to keep the positive cases of COVID-19 low in North Dakota. They'll be working with our state health department, local officials on case identification and investigation and contact tracing, community mitigation, infection prevention and control. So again, we welcome them. We're great to have these experts that are here with us. And again, we want to emphasize, as we have the guidelines that we've given out, the ND SMART guidelines, which are in line with the CDC guidelines to help slow the spread, which everybody's doing a great job on. But again, even as we talked about opening up the economy again in weeks ahead, if we meet certain criteria. One of the reasons why we're able to have that discussion is because our numbers have been low. Some have concluded, oh, if our numbers are low, we wouldn't have needed to take the measures that we have taken, whether that's the physical distancing, whether that's the increased hygiene, whether that's the taking places of high congregation, whether it's bars or personal care businesses, and having a mandatory shutdown period for that small portion of our economy, because as you know, energy, agriculture, and healthcare have all been free to continue to operate. But the steps that we have taken worked, and that's why we've got low numbers. It's not because there wasn't a threat. The threat of the coronavirus is just as strong as it was 6 weeks ago and 3 months ago. It's still a deadly virus. It's still just as contagious. It still could spread. It still could come back. We could still have another surge. So again, our ability to reopen depends on our diligence in maintaining these practices that we've talked about here, and many of those practices will need to be continued on even after we, quote, reopen. But again, you're doing a great job. North Dakota's been a star in terms of how our numbers look relative to rest of country, rest of world, and that's all because of the great individual responsibility that each of you have shown. So thank you for being North Dakota smart, staying home when you can, only travel for essential needs, staying healthy, and staying connected. Today, the next topic is we just moments ago concluded a call that lasted about an hour and 45 minutes with the White House, President Trump, Vice President Pence, and his coronavirus task force. And I think we had 54 of 55 potential governors. We get to that number because they include 4 territorial areas, like Guam would be one of those, and also Washington, D.C. On that call, they previewed the announcements that are going to be made tonight from the White House at 6 p.m. or 5 p.m. Central, called Opening Up America. There's a series of criteria that they're going to be talking about, and it's going to be a proposed phased approach. Governors will be in charge of their state in terms of the timetable of when this happens, and again, it can be state by state, or they even have offered the flexibility, because when you've got states that have really large metro areas and then small rural areas, you could think of many states that fit that criteria, but they've even given the flexibility to suggest that it's not only state by state, but by county in terms of how the reopening may occur. In this proposal tonight, there's optimism, and that optimism varies by state based on where people are on their individual curves. The White House understands that this pandemic is reaching different parts of the countries at different timetables, so there are no specific dates like an opening date in the White House proposal, but there is criteria, and that criteria looks at all the things that we've talked about in these press conferences here, which is the trend lines as percent of positives, the number of new cases, the amount of hospital capacity. So it was exciting to see that the criteria that's being discussed in the Opening Up America again mirrors almost identically what we've been tracking here in North Dakota. So it's based on up-to-date data and the readiness of the healthcare system. It also, in the plan, will talk about mitigating the risks of resurgence, which we've talked about, that just because we decide to open up again doesn't mean that the virus is solved. It means we could have another spike, another peak down the road. We may have just deferred that, and so then, how do you mitigate the risk of resurgence, and how do you tighten back up if you have to? The third component of Opening Up America again talks about protecting the most vulnerable. That's a key component of the ND Smart Restart Plan. And so again, the readout from all that was that we're in tight sync with CDC, and we're in tight sync with the White House in terms of direction, and pleased to see that the direction that's being offered to the governors is a data-based approach with the timing up to the governors based on the data of your own state. So again, that's good news. And so then for us, at least we can control some of this, because we can control how quickly we ramp up testing, how quickly we build up the contact tracing, how diligently we continue to follow the rules that we've laid out under North Dakota Smart Guidelines, and then continue to work, as we described yesterday, that those industries, that the narrow set of businesses that were mandated to be closed, continue to work with your association, with the Department of Commerce, with our economic resiliency team, with our North Dakota Smart Restart team, to make sure that we've got the right kind of guidelines in place for that reopening. A number of things that we talked about yesterday that would be new standard operating procedures are also going to be included. You'll see those in the new you can see those in the new Opening Up America again. Next topic, CARES Act funding received. I want to give an update because, as we said yesterday, some of that money has started to flow. And the CARES Act, of course, stands for the Coronavirus Aid, Relief, and Economic Security Act. It established a $150 billion relief fund, which allocates money to states and political subdivisions. That money can be used for COVID response cost. The relief fund allocation for North Dakota as part of the CARES Act was $1.25 billion. And the minimum share, state share of this allocation is 55% of that, or $688 million. And the maximum local share is 45%. The rules on the criteria for this are not yet released. We expect to see them tomorrow, but we did submit our application to the U.S. Treasury back on Tuesday the 14th for the funding that was available. That money arrived the very next day on April 15th. Yesterday we received our initial allocation of half the money that's going to be allocated in North Dakota for the Coronavirus Relief Fund, $625 million. That money has been received by State Treasurer Kelly Schmidt, and as is her duty, it's been deposited at the Bank of North Dakota, which again, even as it does nothing right now, this moment at the Bank of North Dakota, it is strengthening the balance sheet of the Bank of North Dakota, which will give the Bank of North Dakota more flexibility in terms of what they might be able to do as we work our way out of this economic situation. So anyway, that's good news that the money has arrived, and we'll get more guidance tomorrow. We know from the early guidance, if people are wondering what you can spend it on, we know that we can spend it on expenses related specifically to the COVID-19 emergency, much the same way when we get a FEMA presidential declaration, that then we again keep our expenses, so to speak, at the local and state level, and if it's spent money related to that, they can be reimbursed. We expect that at a minimum, but we will see right now. There have been certainly allowed feedback from the governors that there needs to be maximum amount of flexibility, because right now it's not clear that that money, say, could be used to support the unemployment insurance fund, which is a place where I'm sure a lot of governors would be applying those dollars. But guidance from U.S. Treasury is, like I said, expected later this week and hopefully tomorrow. Next topic has to do with the Payroll Protection Program and a B&D loan program. This morning, Treasury Secretary Steve Mnuchin and the Small Business Administration announced what many of you have probably already heard in the national news, is that the SBA has fully expended the $349 billion appropriated for the Paycheck Protection Program, or PPP, plus the $10 billion for the Economic Injury Disaster Loan Program. Both of those funding streams were created in the CARES Act. Both of them were on a first-come, first-serve, and the money is gone. There is a bill before Congress right now that's being debated, unfortunately along partisan lines, but it does include, if you will, a reload of another $250 billion for the SBA loans. I would tell you to call your senator or congressman, but I can assure you that that both our senators and our congressmen understand and are fully fighting and supporting to get those dollars reloaded, and they're fighting on behalf of all the North Dakota small businesses and business owners in the state. So there's full support. So I'm just sort of joking. You don't need to call them, because we've talked to them and we know that they're fully supportive. Of the loans that were processed, we've got a little bit of a dense chart here, but we wanted to share that in North Dakota there have been over 8,200 loans from North Dakota businesses totaling nearly $1.4 billion. And those 8,200 loans are out of the nearly 1.7 million loans that were approved over the last couple weeks. And again, this is a loan program where it's a loan to a small business. If you maintain 75% of your employee payroll over a period of time, the loan becomes a grant and it's forgiven. And that's why it was, I'm sure, so popular. But I want to thank the local financial institutions, because the way these loans happened was the SBA was administering this, but small small businesses went to their local banks. Our local banks have been working overtime the last 2 weeks, providing service to their customers. And I want to show the next chart because graphically a little bit easier to understand. But I want to say again, thank you to all of our local bankers. I want to say thank you to Michelle Comer and the great work of everybody over there in the Commerce Department. By North Dakota getting the word out, including, with the help of all the media here and through these press briefings. I mean, from the very first day this was announced, we said it was first come, first serve, and people should get going, and people listened. And you'll see on this chart right here in terms of loan dollars that North Dakota, relative to other states of similar size, in similar size and per capita number of small businesses, that North Dakota came out on top. And this is, again, credit to all those small businesses who got their applications in early. We know that there are others who got their applications in or are getting them in today who came up short. And again, we'll continue to advocate with the federal government to reload this loan program. And again, it's a loan program that turns into a grant. The grants are primarily, they're not for business expansion. They're not for acquisitions. They're for paying payroll. And this is a way to help businesses maintain their team members, their employees, and help those businesses stay afloat. And it also, of course, would take some pressure off the unemployment system. So really smart program, and I hope that Congress will see fit to get this reloaded and well stocked again. One of the things that we're fortunate about in North Dakota is we're the only state with a state-owned bank, and that gives us a unique competitive advantage nearly all the time, but especially right now. And since the pandemic began, BND has worked closely with the community banks across North Dakota, assisting in implementation of loan modifications, lowering interest rates, doing a number of things for businesses and homeowners and student loan borrowers. The bank has helped over 4,000 student loan borrowers deferring their payments for 6 months. And again, their mission is to deliver sound financial services that promote agriculture, commerce, and industry in North Dakota. And especially in times of need, the state has relied on BND, and this pandemic is another example of how the Bank of North Dakota can deliver on its important mission. And it's important for business communities to know that BND is currently developing parameters for a COVID-19 financial relief program in partnership with local community banks. It's anticipated this program will provide longer-term, low-interest working capital loans to North Dakota businesses. I was on a call with Lieutenant Governor Brent Sanford, Bank President Eric Hardmeyer, and his team today for nearly an hour talking through this. They've received a lot of input from community bankers and businesses, and we're aiming to provide more details next week. But again, as we said, we intend to have the Bank of North Dakota try to fill in the gaps between the federal programs as they become more clear. That clarity of the federal program is emerging, and there will be an opportunity for BND to step up. Next topic is workers' comp COVID coverage update. We're grateful, incredibly grateful to the North Dakotans on the frontier of front lines on the effort to slow the spread. And on March 25th, I signed an executive order extending workers' comp coverage to first responders and healthcare providers who contract COVID-19 as a result of that work, recognizing that this exposure and risk can continue even after someone has passed away from COVID. I signed an amendment to that prior order, making it clear that the extended coverage also applies to funeral directors and individuals employed at funeral homes or work in mortuaries who test positive and can demonstrate that the virus resulted from exposure to a deceased individual who tested positive. The work environments of all those that are covered by this executive order are those who have a potential significant increase of their exposure to COVID-19, and it ensures that North Dakota continues to go above and beyond and take care of its frontline workers by providing coverage to those most at risk who coming into direct contact with this potentially deadly virus. The amended order continues to provide coverage beginning, so it's backdated to March 13th, the day the state emergency was declared. And if you find yourself wanting to apply for benefits related to this, whether you're a first responder, a healthcare provider, or someone now in the mortuary business, you simply file your claim online at workforcesafety.com. Next topic I want to talk about today is there's so many aspects to our important economy and plays where North Dakota plays a mission on a global level. We participate in a global mission in global economy and oil. We do it in agriculture. We've got universities that span and touch people across the globe. But we've also here are fortunate to have two very strategic air bases in North Dakota, and these are big operations with lots of military employees, civilian employees, families, schools, theaters, grocery stores, base exchanges, clinics. They're literally cities in and unto themselves. And today, along with General Dorman, we had an opportunity to do a conference call with all three of the terrific wing commanders that serve in the U.S. Air Force in North Dakota, leading their missions at the Grand Forks Air Base and the Minot Air Force Base. North Dakota is honored to be the home to more than 8,000 military members and civilians that are stationed here, and we're grateful for their service. The Minot Air Force Base houses the 5th Bomb Wing and the 91st Missile Wing. Both those wings, the base employs 5,494 military members and 677 civilians. Grand Forks Air Force Base is home to the 319th Reconnaissance Wing and employs more than 1,400 military members and 400 civilians. As we work to slow the spread in North Dakota, our air bases are doing a fantastic job, and they're working to limit the cases among their population. They're working with the lead hospitals in their communities to fulfill their needs and support our efforts while continuing to deliver on their very important strategic defense missions that they have for the United States. And I'd say, more important than ever during a time of global instability like right now. Colonel Cochran of the 5th Bomb Wing, Colonel Harris of the 91st Missile Wing, both of Minot, shared with us all the great practices that are going on there. And again, the results have been fantastic. They've had one positive there at the air base so far. That was early on. It was contained. They've had no breakouts since then. That individual has recovered, but they're doing a great job of restricting access, practicing good discipline and physical distance even as they continue to do their work. And they've also got a mask policy in place where if people are unable to maintain the appropriate 6 feet of distance as part of their work, that people are wearing masks. And so again, only one case between the two of them, and so we really, again, thank them for the great work that they're doing. We also have a special welcome that we want to give out today. 300 airmen and airwomen from the 5th Bomb Wing and Minot will return from what is a historic bomber mission from Guam because they were there for 9 months. Prior to that, there was a 6-month mission also conducted by another bomb wing from Minot. So 15 months, and these folks, again, leaving behind family members back here in Minot, but they're all returning today. B-52s, 6 are flying back, landed this morning. There's a military, but effectively a commercial airline flying direct from Guam to Grand Forks Air Force Base with over 200 people on that aircraft. So again, we welcome them home. There is a very solid plan in place as these airmen return. They're immediately going to go into 14 days of isolation. Then they're going to go through their remitting process as they get new orders, but then they're going to go on 14 days of restricted R&R. And again, these folks have been on deployment for 9 months. We welcome them home. We thank them for their service, and we thank the leaders of these air bases for how smartly they're handling their bases during this time of crisis. And thank you to all the support that these air bases get from their communities, both in Grand Forks and Minot. We know there's a lot of civilian support and healthcare support outside the air base. Thank you for that. We know that there's also elementary schools on these bases, and so again, thanks to DPI and everybody who's working to ensure that those children of those military members are getting their distance learning applied in this time. So, so again, great work going on there, and thank you to all of those military members and to our many military retirees from those two bases who have stuck around in North Dakota. Thank you for that. Care 19 update. Again, we continue to see growth on the app. More than 18,500 participants. Again, if you haven't, take a moment, check it out on the Apple App Store or download it, and we'll keep you posted on the Android release, which has now had a short slip, which looks like it's going to be early next week, but we'll keep you posted on that. Unemployment, next topic. Regular claims today, happily, they're still large, but slowing down a little bit. 1,379 regular claims, 234 of the pandemic unemployment assistance claims, and 228 of the pandemic emergency unemployment compensation claims. So fun to see those slowing down a little bit. Total regular claims since March 16th is 52,444. And then the other two categories, 6,055 and 6,192, both since April 4th. Next update, we try to include something every day on behavioral health, and the Department of Human Services continues to take the lead. As you know, the reason we talk about behavioral health is because it's just as important and sometimes even more important than our physical health. These go hand in hand, and during periods of isolation, financial stress, anxiety, life changes, all the things that are going on right now can cause changes and challenges for people that might be struggling. And so we want everybody to know that while we are, as the state of North Dakota has continued to remain open, and our 8 regional human service centers are all open, and the satellite clinics are all open, providing outreach and clinical service. That's Minot, Williston, Devils Lake, Grand Forks, Fargo, Jamestown, Bismarck, and Dickinson. And traffic into those behavioral health clinics is down, with many clients opting to cancel appointments. The clinics continue to provide psychological assessments, group and individual therapies. Medication delivery and in-home services also continue, with team members being provided PPE or personal protective equipment as required. And when possible, the services are being provided by telehealth to allow for the social distancing recommendations. And over the last 2 weeks, the Department of Human Services team has developed and implemented a transition to telehealth plan to better meet the needs and clients of team members. And so again, I want to say thanks to everyone that's done this, because this has been remarkable and probably something that we can keep on doing going forward. Prior to March 1, DHS had 71 providers that they worked with around the state that utilized telehealth to deliver services. By the end of March, that had grown to 174 providers, so that was more than 100 in growth. This week, 359 professionals are now delivering behavioral public health services through telehealth across the state. This includes addiction counselors, psychologists, nurses, prescribers, case managers, skills trainers, emergency service team members. Thank you to the behavioral health team, and continue to provide these essential services. And again, behavioral health emergency services are available 24 hours a day. And available to all North Dakota residents. The emergency service, you don't have to be an existing client, don't have to be registered. Individuals interested in services can call the Human Service Center closest to them where they live. For contact information, the crisis hotline numbers, hours of operation can be found at nd.gov/DHS. Look under locations, and you'll find what you're looking for. And again, I want to give a shout out to all of the people that work in human services that have continued working. Thank you for ramping up the telehealth. Thank you for staying in touch with all of your clients and your patients as we go through this time. And I want to also thank all the peer support specialists and care coordinators who've kept working through this with people who are seeking to maintain their recovery. So thank you for all the great work you're doing. The next update is, I'll put this in the fun category, and it has to do with fishing. We know that getting outside can be tremendously beneficial for our mental health and for our physical health. With the weather improving this weekend, we want to remind everyone again how to practice the appropriate physical distancing while fishing. Just like we're encouraging everyone to practice this physical distancing and wear a cloth covering when you're leaving home for essential errands. If you're going to be in a place where you can't be sure that you're going to be able to maintain 6 feet of physical distance. We recommend you do the same while fishing and enjoying the great outdoors. North Dakota Game and Fish reminds everyone that while you're fishing from the shore, you should remain at least a fishing rod's length apart. I've seen some of these memes online where people in the grocery stores are wearing like the foam floaties that stick out 6 feet like a hat, and then no one's supposed to come within that range of them. But if you got your fishing rod, you can just put it out in either direction. If you can touch your neighbor with your fishing rod, you're too close, and give your fellow anglers some space to keep your community safe. And again, really to be polite as you're doing this. If you're fishing from a boat, social distancing still applies on the water, just like it's okay to get in a car with your immediate family member or your household contacts. Fishing from a boat with your immediate family members are okay. Bringing along or going with others that you don't already have close contact with is discouraged. And so again, this is a, stay within your pod, so to speak, as you're maintaining this, you're protecting yourself and your family. We are reminded that anglers to practice this distancing when purchasing their fishing licenses, and signs are being put up at historically popular fishing locations. So again, don't crowd if you're standing behind someone in line. Create some space there. And again, boat ramps on a sunny day, I'm sure, look like they're particularly busy. Game wardens and field staff are regularly monitoring areas. There's going to be signs posted about practicing the good social distancing and observing that good courtesy to yourself and others. And again, if we see situations where that again, rather than trying to close the whole fishing season, we have said if needed, our game wardens will close bridges, they'll close areas of concentration, they'll close boat ramps if they have to. Again, so it's important if you want to maintain the privilege to keep fishing in North Dakota during the season, it's important that everybody sort of adopt the new approaches. There have been some concerns that have been raised about non-resident anglers. In the short term, right now, people should know that non-resident fishing licenses are down 70 to 75% from last year. In the past years, the majority of non-resident fishing does not take place until Memorial Day and Labor Day. So between now and Memorial Day, we feel like because of all the other states' restrictions, there's a we don't think it's going to be a big issue because such a big drop that we're showing, but we do want to make sure that, again, whether you're in state or out of state, if you're here, enjoy the great outdoors, catch a few great fish, but remember to be courteous and practice the social distancing. And again, this is probably I know some people get very affectionate about their own favorite fishing spot, but if it's crowded, maybe this is the year that you can find a new favorite fishing spot. And again, as our tourism department says, follow your curiosity, don't follow the crowds. Also have some good news on the fishing front, which is that North Dakota anglers' future fishing prospects, North Dakota Game and Fish has maintained their very important spring fish spawning operations. As you know, that we've got one of the best states in the nation in terms of our team that does our spawning operations here. Other states, including some neighboring states, have canceled this, but our North Dakota Smart Game and Fish employees are doing the work when they can't maintain the physical distance of 6 feet or more. They're wearing masks, they're wearing gloves, they're not showing up for work if they don't feel well, and we're giving them all the right kind of gear. But again, we do have some of the best fishing in the nation. While states have abandoned theirs, we've adapted, and we are actively managing 402 fishing lakes. So again, if you feel like that someone's in your favorite spot, there has to be hundreds of lakes in North Dakota that you've never even launched a boat or stood on the shore of. And again, there are plans this year to stock 220 of those lakes again this year. Last year, the North Dakota Game and Fish stocked 12 million walleye fingerling, 2 million northern pike, and they're hoping to stock the same number this year, plus an approximately 60,000 rainbow trout from our cold water facility next month. So stay North Dakota smart. Good luck to the anglers, and thank you to all of the team members. Shout out today of gratitude to them for their helping to slow the spread and ensuring recreation opportunities for North Dakotans this weekend and throughout the summer. And again, we'll now stand for questions, but before we go, we'll want to say thank you for joining us today. And again, tomorrow, join us at 3:30 for our Friday press briefing. Amy?
I got one about testing for you. You said that, the state, it sounds like month after month is basically hoping to double its testing capacity. How do you get there? Is it a product of more machines, more workers, or are there other factors?
It's a combination of the above, and we do have more machines that are coming online, and so we'll have more actual testing equipment. And then in the lab, part of the way we get to those numbers is we go from 2 shifts to 24 hours a day. So building up the qualified personnel to run those machines around the clock. Jacob and then Dave.
Governor, in reference to the SBA loans all being taken, you've asked for that to be reloaded, as you said. Is there a certain amount that you would hope to have in this state? How much is enough?
Well, I believe that the number that Congress is thinking about is $250 billion. We went, through $349 billion in a matter of weeks. I don't know if the 250 is quite enough, but it is. At least again in North Dakota, if we're Johnny on the spot, so to speak, and people are ready and working with Commerce and working with their local bankers. Again, I'd love to see another chart like we saw here, which is that North Dakota businesses can qualify for a disproportionate share because they were smartly getting in their applications in. And again, this may seem, I have to say, it probably seems a little bit odd for someone who's a fiscal conservative like me to be talking about large packages, but this doesn't match any past. It doesn't fit neatly into any historical patterns, because in the case of some of these businesses, we literally asked them to close. The government asked them to close, and so when the government asks somebody to close, we have an extra responsibility to try to, as a way to say thank you for closing. Now we're going to try to help you get back on your feet again. And because again, if someone was staying at home and had income coming from a source that didn't involve a small business, they could meet all the rules, and particularly if you were, maybe you're already retired or your check was coming someplace else, there has been inconvenience, certainly, disruption, certainly, but for some people disproportionately, there's been an enormous amount of financial pressure, and we don't want to have that financial pressure turn into financial devastation and bankruptcy, because again, this is just such a unique period in time. So I'm glad to see that in a bipartisan way at the federal level, they're looking at trying to reload these. But what businesses can do is get going, for the ones that were mandated to be closed, is get going on working on your plans about how to do a smart reopening, because again, getting back open again is one of the best ways we can also help save these businesses. Dave?
Just to follow up, but it's about the Bank of North Dakota loan program. How is that going to be targeted? Can you tell us that before the guidance released next week? What are you looking for to target those loans?
Well, I think what they're really trying to solve is the issue of longer-term working capital, because some of these payroll protection plans and some of the other SBA things might help kind of replace lost revenue that occurred during these couple months. But then if you get into a situation where the business that you're in is slow to start back up again, maybe you need to reload your inventory in terms of the inventory to, restock your restaurant, restock your shelves, whatever it has to be. Maybe you've got some additional, maybe you've lost employees you have to rehire. So it's the working capital. It would not be used for expansions, acquisitions, working capital needs, and I'd call it in the midterm. And some of the ideas that have been kicked around would be similar to what people in North Dakota would know as the PACE programs, which is, it's a low interest rate, but then there's a buy down, so we can get the interest rate down very low, that really helps provide working capital to help people get back on their feet. And I think that's one of the gaps that's been identified that the federal programs are not matching, is that sort of midterm working capital for mid-sized businesses, small and mid-sized businesses. Online, and then to Lane.
April Baumgarten with the Forum of Fargo-Moorhead. We're starting to see more young people are testing positive. More than 2/3 are under the age of 50, and half are between the ages of 20 and 50. What do you think? Why do you think we're seeing more younger people testing positive, and what do you make of the increase?
For April, I would say that The percentages of people testing positive in those age ranges, I think, are relatively close to the percent of population in North Dakota that's in those age ranges. So I think what we're seeing is that the virus can hit anyone. It is more deadly if you're elderly and have underlying health conditions, but it doesn't mean that if you're, under 50 or under 40, under 30, and in the case of yesterday and today, I mean, we've got cases under 30, under 20, and one today under 10. So it can hit anyone of any age. Quite fortunately, this is less severe and a very, very, very low mortality rate for younger people. So that's a great relief to anyone who's a parent, including myself. And so that's a great relief. But I would say again, we look at this as a relatively even distribution to the population we have in the state in terms of where those cases are living. And maybe we could actually show that at one of these events. We could put those numbers up. Lane?
Governor, last week I had asked you about DOT visits for those over 65. I was wondering if there was any update on that. I know Mike had mentioned it was eye testing is why they needed to still come in. Anything on that yet?
Yeah, I think that's what the answer, Lane, from your question was that if you're over 65 in North Dakota today, to get a license, you got to retest your eye, do an eye test, and at least so far, no one's figured out how to do that online yet. Maybe through this pandemic, someone will come up with it. I would think it might be possible, actually. You could confirm that it was actually someone's, real retina that was there and not somebody subbing in and taking the eye test for you. So would be great if that was, again, through disruption comes innovation, but that would be fantastic. We haven't waived that rule yet. We did, of course, if you're over 65 and your license is expired, I think in one of our other executive orders it applied for everybody that their licenses still were valid. And so if someone is over 65 and hasn't been able to take a retest and their license is expired, I'm quite certain that their license is still valid in North Dakota. We'll go online and then back to Dave.
Jamie Kelly with the Williston Herald. Is the state reaching out to larger employers, especially those in essential industries, about offering testing for their employees?
The state's not reaching out directly, but what we are doing is if we find out, like in the case of the LM Wind plant, if there is a positive in a large congregate work environment, a factory, an assembly plant, we're absolutely positively in contact with those employers at that point in time to try to make sure that we're working with them. As part of our expanded testing that we talked about, in the future, I would envision a time in the future where the testing might be something that an employer might be offering just as part of their own workforce protection. Again, when the tests get dropped down to like the swab mouth test that, lateral flow, that's like a pregnancy test, little piece of thing, that would be, under $5. And those, employers might say, hey, look, if we got 900 people coming in the factory, we should be testing everybody that comes in versus risking having to shut the factory down for a period of time. So I think you're going to see a cost of testing built into people's business models going forward. Those tests aren't available today, so right now we're approaching this through the rapid response team. But if there are any employers that have got concerns or want to talk to us, reach out to our health department, reach out to our ndresponse.gov under businesses employers. We've got some guidelines in there about safe practices. In what's going to be launched tonight from the federal government, there's a component of that also relates back to responsibilities for employers as part of that reopening criteria. Dave?
Curiosity, Governor, the state of Minnesota's partnered with a number of other states in order to do a more regional approach to opening. North Dakota is not one of them, neither is South Dakota, neither is Iowa. Have you been in contact with other states around here have you been looking at a regional approach to?
We have, and we had a call earlier this week where we had what I'd call sort of more Great Plains states. It did include Nebraska and South Dakota and Iowa and Wyoming and North Dakota on that call. I believe on that particular call we also had Arkansas and Missouri on there that would have been invited by Nebraska. I mean, everybody's sort of neighbors and says, hey, I'll call my neighbors. our intention right now is to continue to learn best practices from other states. I did receive a phone call from Governor Walz late last night, and we reached back out to his staff this morning. I know they were reaching out to some other states about, hey, do you want to be part of this? The direction of that whole group, extends all the way past the Great Lakes, and I feel like that some of the earlier conversations that we were having with Wyoming, Montana, North Dakota, South Dakota, and the individual conversations that I was having with Minnesota were more relevant to us because, again, the curve, say, that's going on in Michigan is very different than the one that's here. And so if we're going to collaborate and partner, we want to learn from all 50 states. Our team, through the National Governors Association and through the other Governors Association, that we're looking at what all the other states are doing every day, trying to figure out where the best practices are. But in terms of the how we think about reopening, the ones that really matter the most are probably the ones you border, and particularly where you've got border cities. So we'll continue to work closely with Montana, South Dakota, and Minnesota as we work our way through the backside of this.
Would there be a natural affinity with Moorhead and East Grand Forks and people along the Red River Valley especially?
Yeah, absolutely. I mean, that's where we do have a lot of cross-border activity on all sides, and we're tracking the active cases in all the counties that border North Dakota and the southern portions of the provinces in Saskatchewan and Manitoba. So we're absolutely every day during our brief looking at what's beyond our borders. But from a healthcare standpoint, the place we've got the biggest overlap is on that eastern border, but we've got it in the west. We have a lot of people in Montana that come to Williston and Watford, and we've got a lot of people in South Dakota, the Lemon area, that come up and get all their health care at Hettinger, because we have a great healthcare facility in Hettinger with a lot of providers there. So we're looking beyond our borders for sure. Jacob, and then we'll go online, and then to Lane.
Governor, if I may, you say you want to learn from all 50 states, but there are some states that have seen recognized spikes in coronavirus cases, and their reopening deadlines are weeks after the May 1st deadline that you're aiming for. How does that ideology of wanting to learn from other states line up when there are other states that have already seen their spikes, and you say that you still anticipate the worst to come for North Dakota?
Well, I think that's easy because there's so many differences, particularly as it relates to density and it relates to public transportation. I mean, I think New Jersey, where there was a lot of deaths, New York, a lot of deaths, they get into parts of, Connecticut. That's really one big metro area, and there were so many people that were using public transportation there. I think at the end of the day, when we get to the end of the game and someone can finally do the post-game analysis of this, you're gonna say that those congregate public transportation was probably really really a challenge in terms of stopping the spread. The other thing is that they're on the downside of a curve, but we also take a look. We haven't shared that data here, but we did do an analysis of when was the day a state had their first case, and when was the day they closed their school, when was the day you closed bars and restaurants, and when was the day that you closed personal care businesses. Forget the labels that the national press was using about shelter in place and stay-at-home orders. North Dakota was among the leaders days between first case and when we did closures. It's one of the reasons why we've likely had such good numbers, is because our response was actually much faster than those other states. And so we in fact did learn from them, because we could see that their curves were going up, and we avoided having that big spike because we took action took decisive action sooner on some of the real decisions that reduced those moments where you could have transmissible contact. And again, did it in a targeted fashion. We realized we didn't have to shut down the whole state to achieve the reduction of transmissible contact. So I'd say we were in an advantaged position because we could sit back and watch what was going on in other places, and we successfully avoided what's gone on in some other places. But now we'll have the same advantage here, which is we will be able to learn on how it's working when people are opening up. But another state, might be reopening on a date later than us, but they might still be using a higher percentage of their healthcare capacity for COVID than we did at any point in time. And so we're not looking at the calendar. We have to look at the healthcare capacity. Can we protect our elders? Do we have the new standard operating procedures? Can we get broad-based testing in? Can we do the contact tracing? I mean, those are the muscles we got to build to be excellent at reopening. Because reopening there's risk with reopening because this virus has not gone away. We've slowed it down with all the actions we've taken, but it is still there and it's still deadly.
Jean Schemp with Hometown Radio Group in Minot. More and more states are releasing COVID-19 cases by zip code. Last week you had said North Dakota is working on specifying cases by zip code. Will this information be available to the public and when?
I think I'll do one more check on that, and I think maybe we could make that available tomorrow. Because I've seen a draft map of that, Gene, and I think it's probably ready to go, and we want to make sure that we're, again, complying with all the privacy laws and not, but we'll give it a shot, see if we can deliver that tomorrow. Going to go lane, and then we'll go back online, and then back over to the left side.
Governor, with more and more people wearing masks, we've gotten some reports that there's people struggling to find masks and they don't feel like making their own is going to be good enough. Is there anywhere that maybe the state is providing masks or anybody else that's noteworthy?
Well, the state has a large number of masks in our medical cache, and those are being released again for people that are in high risk exposure, I mean, whether it's first responders, healthcare workers, and that's reserving that because, again, if we do have a surge, we want to make sure that we preserve that. But I do know that there are masks. On one of the governor's calls us on this week, 3M and their plant in Arizona is ramping up their capacity to, I think, 8 million a week or something. I mean, some ridiculous number. So there's going to be more and more supply coming on the market. And again, there's a lot of stuff. I know people maybe don't want to sew their own or make their own or wear a mask that they might use when they're that they would use when they're skiing or use when they're on their motorcycle, but cloth masks can work to protect you and protect others until you get your custom-made designer NDSU Bison mask or whatever favorite mask you want to have. So there's I think we'll see more supplies coming, but glad that people are looking to use them. Particularly, they're important if you're going to be in a sustained period of time with someone who's not part of your pod, who is they're more than within 6 feet of them, so that those are the places that you'd want to think about using them. And I know that employers are also, as they think about their reopening, I think we're going to see demand for masks because I think a lot of businesses, that's going to be a requirement for servers, personal care workers, and others are going to be wearing masks for some period of time. And I want to say, again, and just on masks in general, I've mentioned this before, but when we were kids, nobody wore a helmet when you went skiing, and nobody wore helmets. Even the NHL players didn't wear helmets, which is kind of amazing. And we didn't wear helmets on your bike. So bike, skiing, hockey, nobody wore helmets. Now, most people wouldn't think of doing that. We got more and more young bull riders are wearing helmets instead of their cowboy hats. But when the people that wear helmets, whether you're biking, skiing, hockey, or bull riding, you don't wear the helmet to bed. You wear it when you need it. And I think the same thing with a mask is that we will see people that when they wear the mask, when you're in a position when you can't control whether you're within 6 feet of people for a prolonged period of time who's not part of your group, and the rest of the time, if you're just going for a walk with your spouse or your kids, you're out in a fishing boat with somebody that you already know, a family member, you don't need a mask for doing that. So people will figure out good mask etiquette, and hopefully the supplies will continue to grow.
Matt Henson, WDAY. Given what is happening at the Smithfield plant in Sioux Falls, is there a concern something similar could be happening here? 9 cases were reported at LM yesterday, and now a Fargo area company is reporting another 9 today. Should larger employers consider shutting down?
I think there is a concern that the Smithfield could happen here. That's why we developed the capability a couple weeks ago with these rapid response teams, which can, when we identify a positive, or a group of positives that work in a common location, that we can get there and test lots of people. We have a very comprehensive testing plan that was being delivered. It started at 1 o'clock. Teams left Bismarck at 6 a.m. this morning from the Department of Health, the National Guard, and we've got the capability to test all the people who are in close contact with the positives. We're going to do randomized surveillance testing of other people in the plant that may not have been in contact with them. They're doing the deep cleaning of the plant as it shut down, and this is in full collaboration. The plant's voluntarily shut down by their owners, GE, and the LM management's been fantastic partners on this. City of Grand Forks, local public health, Department of Health from the state of North Dakota, everybody's working together. And as I've said, we have to have the capability to do this in multiple locations within 24 hours, not in one location in 48 hours. So the team that we've got and up and running, we've got to get more teams and more capability to do this so that when we have breakouts, and whether it's in an industrial location or whether it's in a nursing home, because we've got some concerns. We've got 218 facilities in the state of North Dakota, and on the report this morning, there's 9 out of the 218 that have had either one COVID patient or one COVID staff out of those 218. That's among the lowest in the nation, but it's a grave concern for me, because this is where, if you have a plant of people that are in their 20s, 30s, and 40s, you could have a lot of positive cases, and you may have illness, but you may not have death. If a nursing home, people with both age and underlying conditions, then you could have both of those things. And so that's why we want to have this capability for both industrial, commercial, but also for nursing homes. And we're working round the clock to continue to build out that capability. But with that, that's why we've got to have the lab keep building up their capacity as well, so that, because when we'll go out, and we might be doing as many tests in Grand Forks in this afternoon or in the next 48 hours as we did in the whole state the day before. In Grand Forks 3 days ago was on our slides, was one of the counties that had the least number of cases. And now we're showing up in Grand Forks and doing almost more testing in one plant than we might do for the whole state. That's the kind of capability we have to have, and not just for now, but we have to have this in June and July and August, because without a vaccine, we will continue to see hotspots pop up, and the way we get opened up is to have a rapid response team that can come in and shut it down before it becomes a Smithfield. Before we get to, there are over 500 cases plus another 100 or more that are home. So over half the cases in all of South Dakota have come from one facility. Next up, anybody? One more online, keep going.
Scott Hennon with WZFG KFYR Radio. We understand that several school districts in North Dakota are hoping to reopen their physical locations for at least the last bit of the school year. What would be your recommendations for them?
Well, I would say to those school districts that they should continue to remain optimistic. I mean, if we've got a small school district in an area where there's no positive cases and we're coming towards graduation, then certainly there's going to be every effort to say, how do you preserve some of those senior year memories for the folks that are there. Other countries like Sweden and others have started first with K through 6, knowing that this is less, the kids that are that age, are probably, they're not going out at night. And they're maybe not, if kids that are that age could be in a better situation where their parents could make sure that those kids aren't also in contact with people who might be in contact with vulnerable adults. So part of their phased approach was start with the youngest, who are the least vulnerable. So there's a lot of ideas about how to reopen schools, but I would say the other thing is we don't know, again, because we may not be on the way down, we may be on the way up, and places that today have got a 0 on the map could have an outbreak tomorrow. So I think contingency planning about, again, hoping for the best. Could you get back into school for a week at the end and hold graduation? That'd be pretty exciting and something to look forward to. If that can happen, and there's a real chance that it cannot, or would not be wise to do for, again, if your community also had a nursing home in it as well as a high school, maybe that's not and the parents of kids in those senior class work in the nursing home, maybe it's not a good idea to, increase the amount of transmissible contact moments. But I would say it's time to start thinking about, how do we create memories for those seniors if they're going to lose some of those? How do we do something that's special? And again, there's been ideas kicked around about having, in addition to the local graduations, would you do a statewide online graduation for all seniors in the entire state, and then we pool our money, and then those seniors get to pick, who they want as their graduation speaker, and we get some national figure to deliver the graduation address for all the seniors at one time. I mean, let's just think out of the box about what that might be if we were going to do that, or locally come up with some creative ways to continue to honor that. Because again, for the seniors in particular, this is hard to fathom. I can remember the spring of my senior year pretty clearly, and it would have been pretty devastating to think about not having all the things that went on, whether it's prom or track meets or graduation and all of the grad parties, all the stuff that would traditionally go with spring in North Dakota. Okay, I think that's it for today. I want to thank everybody for being here. We'll see you tomorrow at 3:30.